That's Kenya's former president, Uhuru Kenyatta, speaking to Focus on Africa last year. Well, let's hear from a Kenyan nurse who's putting Kenyatta's words into action. Frustrated by a lack of hospital resources for patients and poor remuneration, Beatrice Nyaga moved to the US in 2019 and says what she's achieved with her work life in the last 4 years would have taken her a lifetime if she'd continued to work in Kenya.
I have been a nurse for the last 15 years. So 4 years in the USA and about 11 years back home in Kenya. And during my practice, there are things I felt like if they were done in a better way or if I was in a different environment, I perform better. I'm looking at being in a hospital whereby you need to do a CT scan for a patient and the machine is not working and this patient has to wait for days for this machine to be available. I'm looking at a patient who needs specialized care that is not available. Me as a nurse, me being an advocate for that patient, I feel demotivated when I'm not able to achieve what I think this patient deserves. The pay is not something that is able to sustain a nurse. And irrespective, it doesn't matter whether it's a private or government hospital. Nurses are leaving private hospitals, nurses are leaving government hospitals, so it's all rounded. Looking at the groups that I am in currently, we have more nurses, and not even the ones that are here now. I'm looking at how many people call me specifically to guide them on how they can come here. My husband was very hesitant to come. I will put that right away. He was very hesitant to come because he didn't know what he was coming for. He had a career back home. He was doing well. He felt like for him it wasn't the best decision. But guess what? He tells me nowadays, I'm glad you insisted. That's what he says. They're happy. Kids are also happy.
Kenyan nurse Beatrice Nyaga. Well, this topic formed a major part of the discussions at the 5th Global Forum on Human Resources for Health, which just ended